Welcome to Flex and the presentation of the ABCDs of Medicare. I'm Larry Kassman, Sales Manager of the Individual Medicare Sales Department. Let's talk about the history of Medicare. In 1945, it was first proposed by President Truman. 20 years later, in 1965, it was signed into law by President Johnson, and the first person to receive Medicare was President Truman. In 1997, Medicare Plus Choice Plans started with the Balanced Budget Act of 1997. In 2003, Medicare Modernization Act under President George Bush was enacted, and that changed Medicare Plus Choice Plans into Medicare Advantage plans, and also the added prescription drug benefit. In 2006, that Part D prescription drug benefit was rolled out. So who is eligible for Medicare? Medicare is health insurance for persons 65 or older, or persons who are deemed disabled by Social Security for 25 months. You must be receiving Social Security disability for 24 consecutive months, and then in the 25th month, you're automatically put on Medicare Parts A and B. And what is CMS? CMS is the Centers for Medicare and Medicaid Studies. It governs the actions of Medicare, Medicaid, Medicare Advantage, Part D program, and Children's Health Insurance Program. Most marketing and informational materials about Medicare that are seen by the public must be approved by CMS. And the main focus is to protect those who are eligible for Medicare. So how does Medicare work? Through your payroll taxes, you work, you pay taxes, it goes to the government then sends it to CMS, which is Medicare, and then when the beneficiary has a claim, Medicare pays directly to either the hospital or the doctor. Oftentimes these words are confused, Medicare versus Medicaid, and Medicare is health care, while Medicaid is financial aid with health care. So what is Medicaid? Through the Illinois Department of Health Care and Family Services, it's a state agency that administers Medicaid for Illinois. You apply at your local Department of Health and Human Service office, and for more information on how to qualify for Medicaid, refer to the Medicare and You Handbook, which is available at www.medicare.gov. There are 4 parts of Medicare, A, B, C, and D. Part A is hospital, Part B is medical or doctor coverage, Part C is Medicare Advantage plans, and Part D is standalone prescription drug coverage. Part A, which is hospital insurance, and some examples of covered services are inpatient hospital stay, skilled nursing facility services, home health care, and hospice care. The hospital benefit for 2017, the approved amounts, they change every year. So if you're in the hospital from days 1 through 60, Medicare pays everything but the $1,316 deductible. That's per benefit period. So every time you go in the hospital, you would have to pay that $1,316 deductible. If you're in the hospital from 61 to 90 days, Medicare pays all but $329 per day. If you're in the hospital from 91 to 150 days, Medicare pays everything but $658 per day. If you're in the hospital for more than 151 days, the patient would have to pay 100% of all hospital costs. Part B, medical or doctor coverage. Some examples of those services are doctor services, supplies, diagnostic tests, outpatient therapy, outpatient mental health, some preventive services, emergency services, and ambulance services. And Part B has a premium and a deductible. Part B coverage for Medicare approved amounts are Medicare pays 80% of Medicare approved charges if it's medically necessary, and then the beneficiary would have to pay 20% of those charges. There is a monthly premium, and the annual deductible is $183 for 2017. As you can see in that pyramid, Medicare pays 80% of the claim, and you, the beneficiary, would pay 20% of that claim. The Part B premium that changes every year for 2017, it starts out at $134 a month for new beneficiaries who are starting on Medicare this year. The premium is $121.80 for anyone who qualified prior to 2017 and do not pay more due to their income. Premiums deducted from Social Security checks or quarterly bill from Social Security if not collecting benefits. The state Medicaid program, it pays premiums for those who meet income and asset guidelines on a sliding scale. So you could have all or part of your Part B premium paid for with the state Medicaid program. There is a penalty for Part B. There will be a 10% penalty for every year that you do not enroll in Part B upon becoming eligible. If not enrolled when you are eligible, there is an open enrollment during the period from January 1st to March 31st, and the enrollment for Part B will not start and take effect until July 1st of that year. Here are the premiums. It's called Income Related Monthly Adjustment Amount, or IRMA. Based on your income, you can pay higher premiums. Starts off at $134 and goes up based on your joint tax return, or if you're single, on the amounts on the left. And you can pay as much as $428.60. That's the most you would pay if you are a married couple earning more than $426,000 or $213,000 as an individual. Let's talk about Medigap or Medicare supplements. It's the same thing. So on original Medicare, in the dark blue on the left, the triangle there, Medicare pays 80%. You, the beneficiary, would pay 20%. With a Medicare supplement, Medicare still pays the 80%. And then the lighter blue of shade there, the supplement will pick up the 20%. And then the orange, there's a fixed premium to have a Medicare supplement. Part C are Medicare Advantage plans. Those are provided with private companies contracted with Medicare. Medicare pays a monthly fee to the plan for the beneficiary's care, and the plan directly pays the doctors and the hospitals. Part C plans combine hospital costs, doctor, and outpatient care into one plan. Some of the benefits covers all A and B, which is hospital and doctor, in most cases D, which is the drug portion of Medicare. It typically includes more benefits than original Medicare. It must be at least as good as original Medicare. And beneficiaries will never lose Medicare by joining a Medicare Advantage plan. Additional Medicare Advantage plan, some benefits. The plan may include some or all of the following: Silver Sneakers gym membership at places like YMCA, Lifetime Fitness, Curves, and more. There's an over-counter benefit, either monthly or quarterly, to purchase things like allergy medicine, aspirin, Band-Aids, vitamins, and much more. Sometimes this is with a monthly debit card, or you could go every quarter to their website and you earn points or dollar amounts that you could go on their websites to buy some of those products. Sometimes there's transportation benefits for medically necessary visits, hearing aid benefits, dental and vision, 24-hour nurse hotline, meal planning, disease-specific counseling and care services can be included with Medicare Advantage plans. So where does the money go? For every dollar that's paid to a Medicare Advantage plan, 87 cents of every dollar goes to care and benefits. Part D, or standalone drug plans. Exact coverage and costs are different for each Medicare drug plan. All plans must offer at least a standard level of coverage as set by Medicare. And not all drugs are covered by a Part D drug plan. Plans are available as standalone plans. Some Medicare Advantage plans offer built-in prescription drug coverage. 5 out of 6 persons 65 or older are taking at least one medication, with most older adults taking 3 or more. So it's very important that they get a standalone drug plan with their Medicare Advantage plan. Also with the Part D, there is a premium, and it's adjusted based on income as well, just like you saw in the Part B premium also. The guidelines are single, married for income levels, and on the right is what the premium that will be added to your Part D premium. The Part D premiums vary anywhere from $17 a month to over $100 a month, depending on what plan you get. But it doesn't matter which plan you get. Based on your income, you can pay an additional $13.30 or up to $76.20 based on your income, and that's added to whatever premium of the plan that you choose. There is a late enrollment penalty for Part D. Individuals who miss their initial opportunity to enroll in a Part D will likely be subject to a penalty. So Medicare calculates a penalty by multiplying 1% of the national average, let's say, of the premium, which is $35.63 in 2017, times the number of uncovered months that you didn't participate in having a Part D or credible coverage. And the monthly premium is rounded to the nearest 10 cents and added to your monthly Part D premium. What that really means, let's say you go a whole year and you forgot for some reason, did not enroll in the Part D drug plan, you could be penalized 12% or 1% a month. So roughly if you take 12% of $35, you're talking about $4 or $5 extra premium that will be added to your drug plan premium going forward, and that will last forever. And the penalty could go back as far as January 2006 when the current drug plan law was enacted. The bigger penalty is having to pay the retail price for an expensive medication while not covered on a plan. So yes, there is a penalty, and the penalty could be an extra $5, $6, depending on how long you wait to enroll in a Part D. But really the biggest penalty that we get people called every year, they call us for, what can I do? I didn't sign up, and I'm taking this very expensive medication. That to me is the biggest penalty. You never know when you're going to get prescribed a very expensive medication. And if you don't enroll, you can't not enroll in a plan until the next open enrollment period with a January 1st effective date. This is the most complicated thing that confuses people the most. It's called the coverage gap or the donut hole. And how it works basically for 2017 is once you, with your copays, and the drug carrier pays $3,700 towards the cost of your medication, you go into the coverage gap. Once you are in that coverage gap, instead of having a copay, you will have to pay 40% of the cost of brand name drugs and 51% of prescription drugs. Once you have paid more than $4,950 out of your pocket, then you go into catastrophic coverage, where you will not pay more than 5% of your medications, with a minimum of $3.30 for generics or $8.25 for brand name drug costs. Extra Help, which is a low-income subsidy that helps people with their drug cost. It's a program that lowers the cost for Medicare prescription drug coverage. Beneficiaries must qualify to join this plan. In 2012, 36% of the Medicare Part D enrollees receive low-income subsidies. Nearly 1 in 5, or 20%, low-income Medicare beneficiaries are eligible but not receiving this assistance because they don't know about this plan. So how the plan works, once you do qualify, the low-income subsidy or an Extra Help may pay for your Part D premium. You will have low copays, and you will not have that complicated donut hole or coverage gap that we spoke of earlier. So how do you qualify for LIS, low-income subsidy? In order to qualify, individuals must be receiving Medicare, have limited resources. You must have less than $13,640 for an individual and less than $27,250 for a married couple living together. You must have limited income. The income must be less than $17,655 for an individual, and for a married couple must be less than $23,895. Reside in one of the 50 states or District of Columbia. As you notice, these income and resource levels are above the Medicaid level, so you can earn more and may not qualify for Medicaid, but you may qualify for the low-income subsidy. Let's talk about the Medicare Advantage and the Part D enrollments. There are 3 types of enrollment periods. The initial, when you are first turning 65. Then there's a special, which is a year-round qualifying event that you can enroll. And then there's the annual at the end of the calendar year, which is October 15th through December 7th, that has a January 1st effective date. So the initial coverage, it's when individuals first become eligible for Medicare, either when turning 65 or the 25th month after being deemed disabled through Social Security. So let's assume your birthday is in June. You could apply 3 months prior, so you could sign up for March, April, May, and June, and then 3 months after, which would be July, August, and September. That's if your birthday is in the month of June. Special enrollment, called the SEP, is for people who qualify to enroll due to a special circumstance or situation, such as moving into or out of a planned service area, gaining or losing eligibility for Medicaid or financial assistance, qualifying for extra help for prescription drug coverage, that's a LIS we spoke about, losing employer-sponsored insurance coverage, terminating a current plan, and turning 65 while already on Medicare disability. The annual enrollment, which is from October 15th to December 7th, all Medicare beneficiaries can enroll, switch, or drop a plan. They can do anything they want during that time period. You must apply from October 15th to December 7th, and the effective date will be January 1st. There is also a disenrollment period for Medicare Advantage plans. Let's say you had a Medicare Advantage plan, you forgot to change plans during that open enrollment. So you could disenroll from a Medicare Advantage plan from January 1st to February 14th every year. So the Medicare Advantage customer may disenroll from their plan, but they could only return to original Medicare and select a standalone Part D product or a Medicare supplement. You cannot switch to another Medicare Advantage plan. That's the key. So if you're on a Medicare Advantage plan and you forgot to get off of it during the open enrollment because you wanted to go back on original Medicare and sign up for a Med Sup and a Part D drug plan, you cannot do that during this disenrollment. You cannot change to another Medicare Advantage plan during this disenrollment. You have to go back onto original Medicare, get a Medicare supplement, and a Part D drug plan. The lock-in period, which means we're in now from December 8th, when the open enrollment ends, to October 14th from when it starts the following year. You're locked into the plans that you have for Medicare Advantage plan unless you have a special election or an SEP qualifying event. So let's summarize what original Medicare is. Medicare pays 80% and the beneficiary pays 20%. Part A, per occurrence deductible at a hospital is $1,316 every time you would have to enter the hospital. There are unlimited out-of-pocket expenses. Part A enrollment is automatic for most and usually does not have a premium Medicare Part A. You've paid that through your payroll taxes, and you must have worked at least 40 quarters or 10 full years. You need to enroll in Medicare Part B, but if you work for a large employer over 20 lives, you may not have to enroll in Medicare Part B if you don't want to. If it's less than 20 lives, Medicare will be the primary, so yes, you need Medicare Part A and B if you're on an employer group plan that has 20 or less employees. Part B has a deductible of $183, and the premiums start out at $134 per month. You should add a Part D prescription drug plan when you get a Medicare supplements. Original Medicare does not have a network. As long as your doctor and hospital accepts Medicare, you're fine. As you can see by all these out-of-pocket potential costs, that's why you need to get another plan such as a Medicare supplement, Medicare Advantage plan, and a standalone Part D drug plan. Let's summarize what Medicare supplements are. They cover the 20% that original Medicare does not cover. No network restrictions. It's portable. You could buy one in Illinois, move to another state, and keep your Medicare supplement. You must have both Medicare Part A and B, doctors and hospital. Should have a prescription drug plan, like I said, to cover your medications, because you cannot sign up for a Part D drug plan at any time. You do it through a qualifying event if you lost coverage, but if you miss the opportunity, you would have to wait to open enrollment. Premiums will increase every year as you get older. Some carriers require medical underwriting, but if you're new to Medicare, there's no underwriting. And if Medicare does not approve the expense, if they deem it not medically necessary, then the Medicare supplement will not pay. Summarize Medicare Advantage plans. Private insurance companies issue those plans. They utilize carrier networks. So you must make sure when you get a Medicare Advantage plan that your doctor and hospital is in the network. Sometimes if it's an HMO type of plan, you may not have an out-of-network benefit. So that's why it's imperative that you check your doctors and hospitals to make sure they are in that network. They do have the best clinical outcomes because it is, you do have a primary care physician who will oversee your care. It's called managed care, so they make sure their clients are seeing their doctors, taking their medications, and they get best clinical outcomes from these plans. You must have both Medicare Part A and B. Most include Part D prescription drug plans built into it. They must cover everything that original Medicare does cover. Now, even though they have lower premiums, there's co-pays for everything, such as doctor visits. If you have a hospital stay, you may have to pay $200 to $250 per day for up to 7 days. And then after that, it will be covered at 100%. And there are annual maximum out-of-pocket, which range anywhere from $2,900 to $6,700. And those out-of-pocket maximums are for Part A, hospital, and Part B for doctors. The drug coverage has its own out-of-pocket maximums for those. They have reasonable co-pays for most services, can save significant amount of money throughout the retirement versus supplements and original Medicare. If you'd like further questions, please contact me or comments. My name is Larry Kassman. My phone number is 847-699-6900, extension 4322. My email is lkassman@flexiblebenefit.com. Our other associate is Mary Ann Graben. Same phone number, but her extension is 4308. And her email is mgraben@flexiblebenefit.com. To learn more about Flex, visit www.flexmarketplace.com. Thank you very much. Any questions, or please